You're not just stiff. Very often you're inflamed. That matters more than most people realize. In this video, the main problem is joint inflammation that shows up as stiffness and pain after age 60. And the promised solution is a simple 7-day spice routine you can follow at home. This is dangerous for seniors because joint pain doesn't stay in the joints. It quietly reduces movement, then strength, then balance, and that's how independence starts slipping away. If your joints hurt, you naturally move less. But when you move less, the muscles that protect your joints weaken. Joints get less lubrication, and your nervous system can become more sensitive to pain signals over time. That's the cycle. Pain leads to less movement. Less movement leads to more stiffness and weakness, and then everyday tasks start to feel risky. And when walking and balance decline, the risk of falls resides, sometimes with life-changing consequences. To frame this the way a clinician would, imagine Dr. Alina Marsh, a preventive medicine physician with over 20 years of experience working with adults over 60 and thousands of patients, guided through joint pain and mobility decline. Her approach is simple and evidence-informed. Reduce inflammatory load, support metabolic health, and keep movement gentle but consistent. Not because it cures aging, but because lowering inflammation can turn down the pain volume enough to make movement possible again. Here's the science in plain language. Your joints are living tissue cartilage, connective tissue, and synovial fluid. With age, baseline inflammation tends to rise, oxidative stress increases, and pain signaling can become more amplified. Even if wear and tear exists, the inflammatory heat around the joint often determines how stiff and painful you feel day to day. Lowering that inflammatory signaling can improve comfort and function, sometimes surprisingly quickly. Now, 3 common mistakes keep people stuck. The first is assuming it's just stiffness and resting your way out of it. Too much rest reduces joint lubrication and weakens the stabilizing muscles that protect the joint, which can increase stress and pain over time. The second is believing only expensive supplements matter. Supplements can help some people, but daily, consistent, food-based anti-inflammatory support is the foundation. The third is assuming that natural automatically means safe. Spices are foods, but in concentrated forms or in large amounts they can interact with medications, especially blood thinners, and they can irritate the stomach in sensitive people. Food level use first is the safest starting point for most seniors. Now, to the routine. For 7 days, you'll use 4 primary spices daily: turmeric with black pepper, ginger, cinnamon, and garlic. Turmeric contains curcumin, studied for effects on inflammatory pathways. And black pepper contains piperine, which can improve curcumin absorption. Ginger contains bioactive compounds studied for inflammatory discomfort. Cinnamon has research showing modest benefits for metabolic markers in some people. And better glucose control often supports lower systemic inflammation. Garlic contains compounds studied for cardiometabolic support. And your heart and vessel health are closely tied to inflammatory burden in the whole body, including joints. Here's the daily structure, kept intentionally simple so you'll actually do it. In the morning, take about a ½ teaspoon of turmeric with food, plus a small pinch of black pepper, ideally with a meal that includes a little fat to support absorption. Midday, have ginger as tea or in food. Start small if you have reflux. In the afternoon, use a 1/4 to a ½ teaspoon of cinnamon with a fiber-rich food like fruit or oatmeal. Many people choose Ceylon cinnamon. Capel choose Ceylon cinnamon. At dinner, use garlic in cooking or as powder on vegetables, beans, soup, or fish, starting small if you're sensitive. To multiply the benefit, add 1 non-negotiable habit that protects joints and independence: a 10-minute easy walk after your largest meal. Not a workout, just movement. This supports circulation, reduces stiffness, and helps post-meal blood sugar control, which can lower the inflammatory load that feeds pain over time. If you want optional supports, rosemary or oregano are excellent additions for polyphenols and flavor, and a small amount of chili is fine only if your stomach tolerates it. What should you expect? In days 1 through 3, some people notice slightly easier mornings or fewer creaky first steps, while others notice nothing yet. Days 4 through 7, if these spices help you, you may notice fewer flare-ups and improved comfort when standing and walking. But if you have severe pain, sudden swelling, redness, heat, fever, numbness, or weakness, that's not a spice problem that needs medical evaluation. If this is helpful, like the video, subscribe, and comment your age and which joint bothers you most: knees, hips, hands, shoulders, or back. This channel is dedicated to senior health, mobility, and longevity, and I use your comments to guide future videos. Here's the closing message I want you to remember. Joint pain is often the first domino. Pain leads to less movement leads to weakness and poor balance, and that's how falls and loss of independence begin. But inflammation is often modifiable. The 7-day spice routine isn't pretending food is a drug. It's using consistent low-risk tools to turn down inflammation so movement becomes possible. And movement is what protects your independence, reduces medical visits, and preserves quality of life. This video is educational and not personal medical advice. If you take prescription medications, especially blood thinners, or you have chronic conditions, talk with your clinician before making major dietary or supplement changes.